Dr. Cope, go ahead and get started. There we go. All right, sorry about that. Today's September 14th. This is the Makah EOC public briefing. Dr. Cope, can you get started with your report, please?
All right, good morning. Thank you, Chief Bruner, and hello, everyone. Thank you so much for attending. I'm just getting the slide ready to go. Hold on. There we go. All right. So my name is Dr. Libby Cope. I'm the health officer for the Makah tribe. And this update is with data as of 8 a.m. today. We had 14 active cases here in Nia Bay. We've had 67 cases total. With our vaccine data that's as of 5 p.m. on September 10th, we have 76% of our population that's 12 and up is fully vaccinated, which is approximately 59% of the whole population. And then 83.2% of the population is partially vaccinated, which is approximately 65% of our entire population here in Nia Bay. This slide shows our September projections and the impact of our shelter in place protocol and general change in following the pandemic COVID recommendations. So on September 3rd, at the rate that we were currently headed, that we were headed by September 3rd for September, we were looking at having over 225 cases for the month of September. That changed dramatically by September 7th. And then as of today, we look like if we continue the current trend, we would have approximately 36 cases by the end of September. So that is a pretty remarkable flattening of the curve. This next slide is a little bit busy, but I wanted to show how the percentage of new cases were already in quarantine for the entirety of the pandemic versus just the last 2 weeks. So what this data shows is that in our most recent cases, more of them were not in quarantine. This can be caused by a number of reasons. It is more common now that someone is getting exposed and doesn't know it. So this could be when it's at a store or at a concert, for example, and you just, it's not possible to know. You have to almost just assume that other people have COVID, or more individuals not remembering everyone that they've been in contact with during the contact tracing interview. And I also know that a number of these cases, they just got tested before we'd had a chance to even finish case and contact tracing. It was within hours of knowing about a new case. So that certainly impacted that number as well. But the recommended response would be to treat every high-risk activity as a possible exposure and self-quarantine. This is a breakdown of all of our COVID cases by age. The largest percentage of our cases is in this age group, 50 to 64, but this is for the entire pandemic. So it doesn't take into account any recent trends. This is also for the entire pandemic, but breaks out the different exposure sources and showing that the majority of cases are from household contact. And this is much more recent with the Delta variant is where we have seen household spread. We have had household members, even with Delta, not get the virus, which I think is just usually reflects behavior in the house, either separating to different parts of the household or really good use of masks and disinfectants, et cetera. Other than that, indoor gatherings without masks, and then traveling in an airplane, and then there's a large number, especially now where it's unknown. Often that is when we've got multiple possible sources and we can't limit it down to just one or two. Majority of our new cases throughout the pandemic have not been vaccinated. Smaller percentage have been partially vaccinated, and about a quarter, 24%, were fully vaccinated. Of those who were fully vaccinated, 56% were over age 50, which is thought to cause a decreased immune response to the vaccine and make the vaccine just a little bit less effective. But regardless, obviously an overwhelming majority of our cases have been in unvaccinated individuals. This is the graph that shows the level of phase that Nia Bay was in, starting from March 2020. And the legend for the phases is over here. So phase 0 is shelter in place, phase 1, 2, 3, 4, and then 5 is like no phase. It's basically returning to normal, which we haven't been at since March 2020, of course. And so here you can see where we've had health orders in place. The very first health order put us into shelter in place. And then the next health order moved us to phase 2 and then back up to phase 1. And that was in response to our cases that we had in July 2020. And then we stayed in phase 1 for quite some time and then moved to phase 2 at the end of September and October 2020. And then we had a bump in cases here. So this orange line is the cases per month, like total cases per month. This blue line is total cases over the course of the pandemic. And so this is just to demonstrate, we went down to phase 3 back in February and stayed there for quite some time. And this number, it grew a little bit. We had 3 cases in April. And then we went to phase 4 and simultaneously, and I know there were a number of other things happening with Washington State removing its mask mandate, et cetera. But we certainly got a big uptick in cases right here in August. So, and this number for September isn't done yet. So September, actually right now we've had 17 cases for September. So it should be more like right here. But anyways, I just wanted everyone to see kind of the comparison of where we've been with cases and phases. And then here's the same timeline in Clallam County and what was going on there. And of course, some of our concern is our access to healthcare services outside of Nia Bay, specifically the regional hospitals in Forks and Port Angela. I wanted to get some nice graphics about the third dose and the booster, but I didn't quite find one that would fit. But I wanted to talk about our COVID vaccines. Right now, the third dose, which is something that's recommended pretty much as a part of the normal series for individuals who are moderately or severely immunocompromised. So that's just recommended to be like the baseline, first, second, and third dose for those who have conditions that severely compromise their immune system. The booster is something that is being considered for the general public. Many of you know that it was intended to be approved for use by September 20th, and this is for individuals 8 months after their second dose. Both of these are Moderna and Pfizer vaccines. At this time, there's no recommendation for those who received the Johnson & Johnson vaccine. All right, so just moving beyond Nia Bay to Clallam County, their high risk percent, or they are still considered high risk. Their percent positive is 18%, which is actually a little bit of a dip. It was down in the low 20s for majority of last week, and I believe the week before. Overwhelming majority, again, of these cases are unvaccinated individuals. And they currently have 13 hospitalizations. Unfortunately, that number has gone down because they've had an increase in fatalities. The rate per 100,000 in the last 14 days is 1209, which also is a little bit of a decrease. So there's some possible hope there that things might be going down. As you can see, we're right here at this peak. And the projected trend is to peak at the end of September. But hopefully, or maybe possibly, these are signs that it's at least slowing down. And just a reminder that these Clallam County hospitals are full, and there will be a delay in care and a possible transfer to other hospitals. And of course, they're having a really hard time finding places to transfer to. I'm sure many of you are reading about stories in the news. I think there was one instance where someone needed, they called 43 different ICUs for a patient. And that wasn't in Washington State, but certainly it's something that is concerning. Here are the trends for Washington State. As you can see, we've reached a peak that was over our first biggest wave, the third wave. It does look like it might be dropping down, but it's a little too soon to call. And this is just another look at our regional hospital capacity. So these are COVID-related hospital admissions per 100,000. And then this is, since February, what our school age group for the whole Washington state. And there's certainly been a bit of an increase in the ages 4 to 10 and 14 to 19. Certainly an increase in this group as well. This slide just shows Washington in context. So pretty much the whole map here is red, except for a few pockets where there's some low transmission, but really this is why it's not like we can rely on any other state even to come in and support Washington. It's kind of all over the country at this point. And here's that data just in a different graph. So certainly there was a dip in data right here just from reporting, they think from Labor Day. And then here you can see how the deaths and hospitalizations trail just after the increase in new cases. Starting to see the trickle in of the test results from of variants. So we know by now that a majority of all of our cases, certainly in Collin County, are the Delta variant. I don't have the data on the Mu variant. What we do know right now is that it's still considered a variant of interest, or at least that's, I'm pretty sure that's still current as of this morning. And it does look like the vaccine is effective. So that's promising at least, but certainly something to be concerned about. And then here's where you can see how the Delta variant has slowly, but surely, actually quite rapidly, not slowly, but taken over so that it's basically 100% of all of the test results that they get for the Delta variants. This is just a reminder that we use a close contact definition of 10 feet, 10 minutes or longer, and one person doesn't have protection. Really, if you have been in the same room with someone who had COVID and they did not have a mask on, you should come get tested. And even if it wasn't a full 10 minutes, you might not have to be in quarantine, but certainly there's a risk there of possible transmission. Just a reminder, we do not separate families or households unnecessarily. If households and families are willing to separate, then we do what we can to get them into either a Hobart cabin or other place where they can stay and not risk continuing to spread or transmission to their household members. But if families are not willing to split up, we do not force that at all. And then this is an old slide too. These are just reminders of everything that we know works: avoiding crowds, physical distancing, wearing masks, getting vaccinated does work. There are very few interventions, medical interventions, that have been as effective as the vaccine, as these COVID vaccines. The only reason why we're having this new challenge with the pandemic is because not enough people have gotten vaccinated. And then I wanted to talk a little bit about, oops, let me go back that one slide, about monoclonal antibody treatment. We do have that treatment here. We started last week. We had our first patient used monoclonal antibodies and we had been ready to use them. It's a treatment that's meant for people who are at risk of having severe illness from COVID, but aren't very sick yet. So it's pre-hospital medicine. You don't wait till you get super sick, you do it ahead of that. And you actually have to use it within the first 10 days of exposure or likely exposure for it to be the most effective. It's 4 shots and they are subcutaneous, which means just right under the skin, 1 shot in each arm and 1 in each leg. And we're doing those, again, for people who've been diagnosed with COVID and fit certain criteria that we have to follow for the emergency use authorization. So as a last request, please get vaccinated. If you have any questions about the vaccine, you're welcome to call me directly. I'm at 645-2224. I also recommend talking to your healthcare provider directly about it, any concerns that you might have. Please, if you can, avoid travel, especially in an airplane. And then please continue wearing those masks and doing a great job of keeping those masks over your mouth and nose, and especially our kids. Gosh, our kids have done such an amazing job for the most part wearing masks. So I just want to thank all the parents and guardians out there who've done an excellent job with that. And that's it for me.
All right. Well, thank you, Dr. Cope. Appreciate the update and all the information. Patty, do you have a report?
Yes, thank you. So I just wanted to mention that the small business applications, there was a first round of payments that went out in the mail over the weekend. Not every business received a check at this time. Some are still being reviewed to be issued in October, and there were some applications that were missing information that couldn't confirm income and expenses, so they've requested more information. And that's it for now. Unless anyone has any questions.
All right. Well, thank you. I don't see any questions posed at this time, so we'll go ahead and move into the Makah EOC report. Want to remind everybody we're still in shelter in place. We're in week 2. The evaluation will be done on Thursday with the EOC, and then a recommendation forwarded to the MTC for approval to move out of shelter in place. We have not had that discussion yet. We will evaluate everything, all the information that's been gathered up to this point, and then make that recommendation. So hang tight, keep doing what you're doing. Everything's looking promising and good right now. So thank you, everybody, for what you're doing. Please pass it on, and please continue to do that. Please remember, we're restricted to essential travel right now. If you have any questions on what's allowable, please check on the stick.org website. There's also a spot on there if you wanted to sign up for the Regroup Emergency Notification System, which is the Makah EOC notification system. You can log on and do that on the website. If you're traveling, please be prepared to present travel documents, receipts, and stuff. If the checkpoint staff seems there's an abuse there, they will request those documentation in order to show proof of essential travel. Please be safe when traveling. Take all the safety precautions and measures that are in place when you get home and while you're away. And thank you for doing your part. Everything is looking very well. Please check the stick.org website. You can see the traffic patterns, which is what we're collecting up at the checkpoint, and also ensuring that everybody's abiding by what rules and regulations are in place. That's about it for right now. We are looking to resume mask and hand sanitizer distributions when we move back into phase 2. So we will get those back out to the community, just not at this point in time. No questions at this time. So I want to thank you all for participating. Please check back in next week. Please check the stick.org website daily. That is updated every day while we're in shelter in place. So thank you, guys. Thank you to the stick staff, EOC staff, Makah, the community, and MTC. Thank you, guys, and I appreciate your participation. And we look forward to seeing and talking with you next week. Thank you.